is making the political choice for health. The various sessions of the World Health Summit have addressed taking future-oriented, action-oriented approaches to dealing with how to build a resilient new global health architecture, from principles to resources to technologies. It would be impossible for me to do justice to the richness and the complexity of the discussions here, but perhaps I can reflect on some common threads. Underlying all of the discussions has been an appeal to us to use our common humanity for our common benefit and to embody in and through our work the truth that all people are created equal in rights and dignity. We have been repeatedly called upon to stop privileging some lives over others, some regions over others, to leave our egos at the door and to pull together to build a healthy future for all of us and to invest like we mean it. From inside and outside the rooms, there's also been a sometimes penetrating call to pull together to be much better stewards of our planet. We have also been admonished that youth are not here at our pleasure, but because they should be. We have been reminded of the need to invest in health workers without whom we deliver nothing. Equally, we've been reminded to invest resources and that solutions are possible if we invest those resources in a manner that is strategic, far-sighted, consequent, and sustainable. And we have happily been witness to some significant investments for some big challenges, for polio, for sexual and reproductive health and rights, for antimicrobial resistance. Dr. Tedros, you have been everywhere and indefatigable in this meeting. In the many panels and workshops, you have recalled us to our humanity and to our mutual interdependence. So as we look forward to embodying the political choice for health, I'd like to ask you one final time at this meeting to share with us how we can jointly set the future agenda. Dr. Tedros.
From what our moderator said, he must be tired of me now. Your Excellency, Dr. Tobias Lindner, Excellency Thomas Stephan, Your Excellency, Dr. Carla Visotti, Your Excellency, Dr. Ifremi Wakinabete, Excellencies, and my good friend and brother, Professor Axel Priest, dear colleagues and friends. We have come to the end of another World Health Summit. And I offer my deep gratitude to the government and people of Germany for their hospitality. I also extend my profound appreciation to Axel and your team for your partnership over many months as we prepared for the summit. I thank my many colleagues at WHO who have worked tirelessly to make this event a success, especially Gaudens, Bruno, Carmen, and the rest of your team. And I thank the staff of the Hotel Berlin Central District who have done an outstanding job in accommodating such a large event. I'm sure that, like me, you're tired, but invigorated by what you have seen and heard over the past 2 days. By connecting with friends and colleagues, old and new, and by the level of commitment and energy we have seen for promoting and protecting the health of the world's people. This afternoon's successful polio pledging event with commitments of $2.6 billion puts us on the road to the final eradication of only the second human disease in the history of our species. These funds will make a massive difference to our efforts to get rid of polio for good. Thank you to all the donors who contributed today, and to BMZ for organizing and hosting today's pledging. We're also very grateful to KS Relief for the donation of $10 million to support the work of WHO and UNICEF against polio and measles in 8 countries. There have been a number of other important agreements signed and initiatives launched. Yesterday, WHO launched the Tobacco Cessation Consortium, a business coalition to scale up access to cessation tools, especially in low and middle-income countries. And I was very proud to recognize the work of Dr. Browning King. Thank you for your leadership. Just this afternoon, we announced the creation of a new global network of chairs of parliamentary health committees to harness the power of parliaments for universal health coverage, health security, and WHO's work around the world. Parliaments have 3 very important roles. They approve plans, they allocate budget, and also they oversee the implementation. So we have to work with them closely. We also signed an agreement with the International Association of National Public Health Institutes to strengthen public health services and emergency preparedness globally. And on Sunday, I was delighted to appoint 4 members of the family of Henrietta Lacks as WHO Goodwill Ambassadors for cervical cancer elimination. So there is much to celebrate and many causes for optimism, but it's not all rosy. This morning's launch of the progress report on women's, children's, and adolescent health shows that although we have made some gains over the last few decades, more recently we're going backwards and inequalities are widening. I hope you have heard the strong language from Prime Minister Helen Clark earlier today. And we're all acutely aware of the multiple overlapping crises around the world that are causing preventable death and disease and depriving people of access to health services they need. Even as we meet here in safety and comfort, there are conflicts around the world. Drought, famine, and malnutrition in the Horn of Africa, Ebola in Uganda, a severe cholera outbreak in Haiti, and outbreaks in at least 28 other this year, outbreaks of malaria, dengue, measles, and diphtheria in flood-affected parts of Pakistan, the global monkeypox outbreak, the ongoing COVID-19 pandemic, and the existential threat of climate change, which is making our planet on which all life depends less habitable. Then there are the crises that don't make the news so often. Non-communicable diseases, which are the world's leading cause of premature mortality. Antimicrobial resistance, a silent killer or a silent pandemic, which threatens to turn back a century of medical progress. And the fact that almost 1/3 of the world's population lacks access to essential health services. Even where services are available, almost 2 billion people experience financial hardship by paying for care out of their own pockets. The challenges we face can seem overwhelming. Certainly, they are many, they are large, and they are complex, but they're not insurmountable. In every case, there are solutions, tools, and services that can prevent suffering and save lives. But most importantly, we need to support countries to build resilient health systems based on the foundation of strong primary health care to deliver those tools and services. That means putting countries and communities in the driver's seat so that people get the services they say they need, not what others tell them they should have. Late last night, I was celebrating colleagues' birthday after a long but productive day. Someone asked me what my favorite song was. I said, Imagine. Imagine by John Lennon. I remember hearing it for the first time as a high school student in the 1970s and feeling inspired by his vision of a better world. That vision has stayed with me. And it's the vision of a healthier world that inspires me still. You may say I am a dreamer, but I'm not the only one. In fact, I think I'm in a room full of them. We came to the World Health Summit because we dream of a healthier world in which people can breathe clean air, drink safe water, eat healthy food, and live in conditions that promote health rather than destroy it. While I was coming in, I met Anders Nordstrom, and he told me, I hope in your speech you will stress promoting health, which is true. We have to stress it daily, and that's what we should do, addressing the root cause, promoting health, and helping people to lead a healthy lifestyle. And we dream of a safer world in which all countries and communities are better able to prepare for, prevent, detect, and respond to outbreaks, epidemics, and pandemics. And we dream of a fairer world in which no one misses out on the health services they need because of who they are, where they live, or what they earn. That's the world for which I and my colleagues at WHO will continue to work every single day. Because health is not a luxury. It's a fundamental human right, an end in itself, but it has an added value. It's also a means to development. I might not say it well, but I will keep saying it. Gesundheit ist ein Menschenrecht. Vielen Dank. Thank you so much. And see you next year. But before I leave the podium, please give a big applause to my good friend and brother, Professor Axel Priss, and his team. Thank you. Thank you so much. And to Germany. Thank you.
It's been a real... So we already have our theme music for next year, and we're looking forward to it. Dr. Tedros has given us the full list, not even the full, a partial list of all that needs to be done. And now that the COVID pandemic has taught us that health belongs firmly, squarely on the highest political agendas, our respective foreign ministers have their portfolios significantly expanded, and the unenviable task of tying together all of the threads that enable the multilateral system to deliver the political imperative for health which this meeting seeks. And so, as we perhaps recommit this task to their portfolios, let me please invite Monsieur Charles Michel, President of the Council of the European Union, to address us on the plans. Monsieur Michel is joining us by video link, I believe.
Mesdames et messieurs, monsieur le directeur général de l'OMS, mon très cher ami Dr Tedros. C'est pour moi un plaisir d'être avec vous aujourd'hui, même si c'est de manière virtuelle. Et pour commencer, très naturellement, je voudrais rendre hommage à tous les professionnels de la santé ukrainiens. Vous travaillez dans des conditions de guerre qui sont absolument horribles. Et vous travaillez avec courage pour sauver des vies et pour tenter autant que possible d'atténuer les souffrances humaines. Et je voudrais ici vous dire que nous vous considérons comme des héros, et je voudrais aussi vous dire notre immense respect. Mesdames et messieurs, chers amis, le Covid-19 a fait de la santé publique et de la coopération internationale une question de premier plan, et cela à juste titre. Parce que la santé est étroitement liée à beaucoup d'autres politiques publiques, telles que par exemple la question climatique, la question environnementale, le commerce, l'économie ou encore la cohésion sociale. Et notre santé, on le mesure bien, est directement liée à la santé de nos écosystèmes et plus largement d'ailleurs à la santé de notre planète. Et nous devons saisir pleinement ces liens afin de tenter de relever les défis les plus urgents, tels que par exemple la résistance aux antimicrobiens, les nouvelles pandémies qui pourraient se présenter ou encore les questions liées à la sécurité alimentaire. Et c'est pourquoi je crois intimement que nous devons adopter cette approche One Health. Parce que l'approche One Health, ce n'est pas un luxe, c'est au contraire une condition sine qua non pour l'avenir de la santé mondiale. La pandémie du Covid-19 a porté un coup terrible aux services de santé dans le monde entier. Et cette pandémie a d'ailleurs freiné 2 décennies de progrès qui jusque-là avaient été ininterrompus en direction d'une couverture sanitaire universelle. Et il est urgent d'inverser cette tendance par une action concertée. Nous partageons pleinement cet agenda commun des Nations Unies qui vise à accélérer la réalisation des objectifs de développement durable, et notamment en matière de santé. Et dans le cadre de nos partenariats internationaux, l'Union européenne donne la priorité au renforcement des systèmes de santé et à la couverture sanitaire universelle. Nous sommes totalement déterminés à travailler d'arrache-pied pour ne laisser personne au bord du chemin. Tout le monde devrait avoir accès à des soins de santé de qualité sans qu'il ne puisse y avoir de barrières financières et sans que l'endroit où l'on vit soit une contrainte. Mesdames et messieurs, l'OMS, l'Organisation mondiale de la santé, est bien sûr au cœur de notre architecture sanitaire mondiale. L'OMS est l'autorité directrice et coordinatrice pour relever les défis mondiaux en matière de santé. L'année prochaine, vous fêterez le 75e anniversaire. L'Union européenne est déterminée à jouer un rôle de premier plan pour un processus inclusif qui vise à renforcer l'OMS, en particulier pour ce qui concerne la préparation aux urgences sanitaires et à la réaction à celles-ci. Et c'est d'ailleurs pour cette raison qu'ensemble, avec le Dr Tedros, il y a quelque temps, nous avions lancé cette idée d'un traité international sur les pandémies. Cet accord international contraignant sur la prévention, la préparation et la réaction aux pandémies est en cours de négociation. Et je l'espère, cet accord inclura les amendements au règlement sanitaire international et je l'espère aussi l'équité, la solidarité, une transparence accrue, une coordination renforcée seront à la base de ce futur accord. Et bien sûr, nous le savons, des investissements importants seront nécessaires pour en garantir l'effectivité et la crédibilité, et cela y compris via l'assistance technique et le renforcement des capacités pour les pays en développement. Au-delà du Covid, l'Union européenne est pleinement engagée sur les questions de santé dans le monde entier. Nous travaillons en ce moment à la révision de notre stratégie mondiale en matière de santé. Nous voulons renforcer les systèmes de santé mondiaux et nous voulons lutter contre ces inégalités en matière de santé afin de progresser vers cette couverture sanitaire universelle. Il s'agit notamment de travailler pour la mise en place d'institutions multilatérales efficaces et pour mettre en place des partenariats stratégiques avec d'autres régions dans le monde. La santé mondiale est aussi une des priorités des dirigeants du G7 et du G20. Et d'ailleurs, à cet égard, je voudrais me féliciter du lancement du Fonds intermédiaire financier pour la préparation et la réaction aux pandémies. Et d'ailleurs, nous invitons les donateurs potentiels à s'associer à cet effort. Mesdames et messieurs, très chers amis, il y a plusieurs mois, nous sommes parvenus, après beaucoup d'efforts diplomatiques, à un compromis sur les droits de propriété intellectuelle des vaccins. Nous avons trouvé cet équilibre entre propriété intellectuelle, innovation scientifique et accès universel à la technologie. Et bien sûr, je me réjouis de cet accord, parce qu'il veillera à ce que les pays qui n'ont pas de capacité de production de vaccins ne soient pas confrontés à des obstacles ou à une insécurité juridique lors de l'importation de vaccins contre le Covid-19. La pandémie a mis en évidence les défis que représente l'accès équitable aux vaccins. Et c'est pourquoi il est si urgent d'accroître la production locale de vaccins, en particulier dans les pays en développement. Et c'est pourquoi l'Union européenne, avec le soutien d'institutions financières, s'est engagée à lever plus de 1 milliard d'euros. 1 milliard d'euros pour promouvoir la production locale, pour améliorer l'accès aux vaccins, aux médicaments, à la technologie en Afrique. Et le transfert de la technologie et le soutien aux pôles de production régionaux sont un élément essentiel de ce programme. Avec nos partenaires africains, nous construisons également les premiers sites de production de vaccins du continent, au Rwanda ou au Sénégal par exemple, et d'autres installations seront construites au Ghana, en Afrique du Sud et ailleurs sur le continent. Des vaccins fabriqués en Afrique, pour l'Afrique, avec une technologie de classe mondiale. Et au cours de l'été, nous avons aussi lancé un nouveau partenariat avec l'Amérique latine et les Caraïbes sur la fabrication locale de vaccins et de médicaments dans cette région du monde. Il s'agit d'une occasion de renforcer la santé publique, de stimuler la croissance, de créer des emplois décents, tout en favorisant l'innovation dans le secteur privé. Mesdames et messieurs, chers amis, la santé publique ne doit plus jamais être reléguée au second plan des défis mondiaux. Parce que notre santé, c'est notre vie à tous. Et nous devons la traiter avec le respect et tout l'engagement collectif nécessaire. Et c'est la raison pour laquelle nous sommes rassemblés ici aujourd'hui pour tenter ensemble de tendre vers un monde plus juste et un monde plus sain. Je vous remercie pour votre attention et je vous souhaite d'excellents travaux.
Thanking very much, Mr. Michel, who has given us such reason for optimism. I think for me, I've been in this world for more than 15 years, and we're seeing now this movement towards global health coherence in a way that we didn't see before, that health diplomacy is an important part of all diplomacy. And a country that has pioneered that across its diplomacy has been Germany. In this meeting, we've seen all the ministries who are involved, health, foreign affairs, BMZ was here, I think the Wirtschaftsministry was also here, if I'm not mistaken. We saw parliamentarians from all parties in this meeting, and it really is a model for a coherent approach. And leading that work in the multilateral sphere is the German Foreign Ministry. And so it is a particular pleasure to invite Dr. Tobias Lindner, Minister of State at the Federal Foreign Office, to share with us your plans for keeping health at the center as we go forward.
Dear Director General Dr. Tedros, State Secretary Steffen, panelists, colleagues, ladies and gentlemen, all protocols observed. 3 days of highly relevant discussions lie behind us, and as you said, many of us might be tired in a good sense because we discussed so much. Some of us might have dreamed and have the dreams evolved, but I'm also convinced that we made substantial progress on the challenges that lie ahead of us. And since its inauguration back in 2009, the World Health Summit has become one of the most important dialogue forum in global health. The federal government is proud to have this innovative conference in Berlin, showing indeed that Berlin is an international hub for global health. We wish to provide a welcoming and inclusive environment for all our partners and colleagues worldwide. And this is exactly what we need in global health. International cooperation and solidarity remain our most important tools to tackle global challenges. We need to work in partnership and constant dialogue, be it on climate change, food insecurity, or on health emergencies. Multilateralism matters. From the beginning of COVID-19, Germany has followed a multilateral approach to fighting the pandemic. We have committed ourselves to making vaccines available for everyone, everywhere, even though this has not worked perfectly at the beginning. We supported the Act A initiative, donated vaccine doses, and supported more than 100 countries with ventilators, personal protective equipment, and therapeutics. We stand ready to share more vaccines with those in need, including the new variant-adapted mRNA vaccines. Foreign Minister Annalena Baerbock has put specific emphasis on supporting local vaccine campaigns. In May, our Foreign Minister and her G7 colleagues endorsed an ambitious action plan to address the issue of vaccines, global vaccination, and vaccine production. Germany provides almost $1 billion for so-called last mile efforts. Getting shots in arms remains our priority, especially with a view on the most vulnerable. We are proud that both projects bear first fruits. For example, we supported the purchase of 500 motorbikes in Cote d'Ivoire and solar fridges in Somalia. We enabled the deployment of mobile vaccination teams to hard-to-reach areas in Mauritania and during election campaign events in Kenya. In South Africa, we facilitated youth-led community film screenings and dialogues in districts with low vaccine uptake. Additionally, Germany is the biggest donor to the World Health Organization Contingency Fund for Emergencies. It is a flexible and efficient tool to react to health emergencies, such as the current Ebola outbreak in Uganda. But this panel is supposed to look into the future. So I wish to underline that across ministries, Germany will continue to shape global health. But we can achieve better health only together with our international partners. Let me be clear, no one is safe until everyone is safe. For my ministry and for foreign policy in general, the pandemic has had large implications. Building bridges is a task for foreign policy and for diplomats. The pandemic has accelerated some global trends, including fake news, vulnerability of our interconnected global economy, systemic rivalry. Russia's war of aggression against Ukraine has further exacerbated these challenges. This is why Germany's upcoming national security strategy will also address global health and pandemic preparedness as key issues of our own national security. Nationally, we will strengthen resilience in order to avoid dependencies in our supply chains and to improve early detection of pandemic risks. At the European level, we will advocate for greater coordination of measures within the EU, in particular through the new European Health Emergency Preparedness and Response Agency. We welcome the development of a new EU strategy on global health. And at a global level, ongoing initiatives need to capture the lessons learned from the international response to COVID-19. We will advocate to the newly established pandemic fund, a financial intermediary fund for pandemic preparedness, to become an inclusive and expertise-driven tool to close financing gaps, especially in low and middle income countries. It is great to see the World Bank and the WHO working together for better pandemic prevention, preparedness, and response. Germany also supports negotiations at the WHO for a new legally binding pandemic agreement guided by the principles of equity, solidarity, and human rights. This agreement holds the promise to save lives, protect livelihoods, and leave no one behind. And health is also part of our feminist foreign policy. Quarantines have led to increased domestic violence, made access to reproductive health care more difficult, and disrupted schooling in almost every country. Women have been on the front lines of the pandemic response, and more generally, women represent the backbone of the global health force. Moving into the future, taking into account the gender dimension of individual health needs and health systems is thus more important than ever. We must also jointly advance sexual and reproductive health and rights. This is a key aspect of the right to health and thus human rights. Ladies and gentlemen, dear colleagues, let me finish by underlining that global health is an irreplaceable prerequisite for stability, security, and sustainable peace all over the world. No nation can achieve global health security alone. We need to continue to work hand in hand for a healthier and safer world. I thank you.
Thank you very much, Dr. Lindner, for outlining the commitments, but also for outlining the point, and I think it was also made by Dr. Ryan earlier, that the last mile for global health is the first mile for global health security. Distinguished guests, we're going to change the agenda a little bit now and hear from those who beat the drum at home for investment in health. So joining me now for a panel discussion are Dr. Carla Bisotti, Minister of Health of Argentina, Dr. Iferemi Wankainadete, Minister of Health and Medical Services of Fiji, and Ms. Gelsomina Filiotti, Vice President, European Investment Bank. Where do you take that? I think my mic is still on, and this mic will be then for you. Okay. Dr. Bisotti, Ms. Filiotti, Dr. Wankainadete. A key lesson from the COVID pandemic, repeatedly underlined here, is that significant increases in our investment in health is the only way to secure our common future. Yet, we are currently faced with both a global economic crisis and a global climatic crisis, and in the past, austerity has meant severely curtailing health budgets. We talk of building back better, but how do we concretely shape a different future? Dr. Bisotti, especially in times of economic crisis, how do you get and hold the ear of your treasury and persuade your government to prioritize health?
Good afternoon to everybody. First of all, let me thank for the invitation. For my country and for myself, it's an honor to share this panel. I have to mention two things. Argentina is used to go through periodical social and economical crisis, and when our president started his government in 1929, the 10th of December 1929, Argentina was in an economical and social crisis with a weak health system. And of course, 21 days after SARS-CoV-2 starts, and the 3rd of March, we had our first case in Argentina. But I have to say that our president considers health as a priority before the 19 pandemic. He strengthened the Ministry of Health. He support the polio eradication, measles eradication. We were going through an outbreak of measles, the worst in the last 20 years. So we managed to control this outbreak, and also he support dengue outbreak. And of course, during the pandemic, not only the president and the Ministry of Health, but all the government turned into a response for the 19 pandemic. And it was clear, we knew from before, but it was clear that without health, we cannot learn, we don't have education, work, production, and economical or financial growth. So we keep thinking that health is an investment, not a cost, and that it's not, Tedros said at the opening ceremony, and he keeps saying also this main concept regarding to move from taking care of disease to promote health. And it's about water, air, food, and that's the way not to leave anyone behind, and without wars anywhere else.
Thank you. So it seems, as been underlined also, that if you have the political leadership at the highest level, then it eases your path significantly. Dr. Wankainawete, turning to you, taking the political choice for health, making that choice also means making a political choice for health workers and radically improving work conditions for all of the health workers, but especially for frontline health workers. How are you winning the case for such investments with your colleagues?
Thank you, and all protocols observed, Your Excellencies and colleagues. Our health workers are the heartbeat of the health system. And it is important that we look after them, especially in low middle income countries like ours, as we've heard that there is now a global shortage of health workers. There's now an attrition that's happening in low middle income countries with health workers moving towards middle to high income countries, because certainly the working conditions, the remunerations are much better. We try as much as possible. In Fiji, we've raised the salaries of our health workers over the last 5 years. We've looked at certain things, and I want to reflect, there was a study done by Kimberly Oman from Australia in Fiji, in which they looked at the reasons why health workers leave. And there were 3 important things. One is political stability. Number 2 is the working conditions. And then number 3 is certainly, as part of the working conditions, the opportunity for growth and development, which includes continuous professional development. So those are the areas in which we as a ministry are working with the central agencies to try and ensure that we keep health workers. We know we have an attrition, we train, we recruit, we support. We have a small attrition that goes all over the world. It comes to Europe, it goes to the Mediterranean because they offer better salaries. But we must not lose hope. We continue with optimism to train, recruit, and continue to support our health workers with continued professional development. And that is, I think, the challenge that we have in low middle income countries at the moment.
Indeed, and it seems like a Sisyphean task, and especially when our multilateral support systems are not centered on making those early or far away investments so that the economic conditions are attained that keep people at home, keep them interested in working in their countries, don't make their lives so difficult and so desperate that they seek their fortunes elsewhere. So Ms. Vigliotti, turning to you now and drawing on the experiences and painful lessons that are being discussed here, how do you see the role, the immediate and the midterm, of the European Investment Bank to ensure that from now on, we leave out these false economies and really focus in investment in health in a long-sighted way?
Thank you very much for this question, and thank you also for inviting the European Investment Bank to this very relevant event where we are talking about health. Health matters under several social dimensions, but I would like to stress the economic and financial aspects since I come from a bank and a public bank. So we have learned, actually we already knew before the pandemic how relevant is health for economic development, but I think that over the pandemic we realized how stringent is the link between economic growth and health. Actually, we found out ourselves unprepared. You know, the health systems all over the world, not only in the low-income countries, but also within advanced countries, they were unprepared. Huge amount of money and resources were invested for the emergency, you know, to cure people, but also to support, it's all the economic activities which were stopped. So we realized how relevant is to be prepared and to invest in health. Investing in health, it's not only, it's a human duty for the survival of people, for their care, but also it's matter for development and for economic prosperity. Where we are now, actually, during and after the COVID, there was a huge international mobilization and also a more profound thoughts about what to do for health and to support the international cooperation in this regard. My sense is that it was successful, in particular discover and the spread, the rollout of the vaccines. Unfortunately, we are not yet to a full coverage around the world, but important progress have been made. But at the same time, the international community, asked itself how to cope with this issue, how to cope with the preparedness. And actually, several speakers before me mentioned, how relevant was the issue of preparedness within the international discussion at the G7, G20 level, and the international organization, also the financial organization like the EIB, are involved in that. What is their role? Their role is to provide the resources, finance, to provide technical assistance, but also to mobilize resources, because we know that public resources are not sufficient to deal with such a huge challenge. And what is important is to mobilize also private sector resources. And in this regard, the intervention of public institutions, like for instance, the European Investment Bank, is also a sort of guarantee for private investors. Let me now say what we have done through the year. The European Investment Bank has a long-lasting experience in financing the health sectors. Over the past 7 years, we invested 15 billion of euro within the sector, and 2 billion of these 15 were for investment outside of the European Union, where we have a large experience. How we intervene within the health sector? We intervene with several financial mechanisms. We provide the loans for infrastructure. We provide resources for startup, for biotech industry, and to foster research and development, to build infrastructure, to provide financing support for hospital care. And what is more relevant, what we realized also under the experience of COVID, was that how important is also the preparation of the health workforce. Because actually we were unprepared under several dimensions, and one of these was also the availability of people ready to provide service. If I can add one consideration, is that there was a huge effort at the time of the COVID crisis. The risk is that with the new geopolitical tensions and the spillovers coming from this experience, which can derail the attention from these basic needs, important needs. So what is important is to keep high the attention on these issues, since, as others said, we need an holistic approach. We need a whole of government approach, because I mean, we have to deal with food security, health, climate change, energy. They are all interrelated. And just to finish, I think that we have to preserve and to enhance for people the ability to access the affordability and the quality of public services. And we are there to support these processes and to support governments to do that.
Thank you very much. Just picking up on one point that you raised about the various dimensions in all of government and all systems that need to be involved. You know, and this will be discussed a little bit in the next session as well. But I think of Fiji, Dr. Wankainawete, which is a country really facing an existential threat from the climate crisis. And so how do you make that balance? Where else, for our health, for our survival, do you see critical investments need to be made? If you were to make a case to Ms. Villiotti now, what would that case be?
This is now October. In October in the Pacific is the beginning of the cyclone season. So bunkers down, people are getting prepared. We've been told we'll get at least 3 cyclones, one a Cat 4, which is about 200 kilometers an hour winds, and 2 Cat 3s. That's what the experts say. There was a season they said we'll get 2, we ended up getting 5. So we know we're going to get a cyclone. And it's become part and parcel of our lives. That's notwithstanding the fact that there are countries where there's saltwater intrusion into their soil. That we can only build on one side of the island because the other side of the island they cannot get through. And we've talked about this a lot, how the Pacific actually champions climate change because it's affecting us. But we also see the synergies that happens with climate change and the One Health that we are pushing at the moment. Because we need to save the planet and make it healthier so that we can save mankind, save animal kind, save humankind, save animal kind, save plant kind, encourage robustness and diversity within the organisms that live on the earth, and ultimately stop extinctions. Because when extinctions do happen, the next on the list is us, mankind. And so the investment case that I can propose to you today is the investment case, number one, of the investment case of saving mankind, saving Pacific peoples, saving their livelihood and saving their culture. And I know Europe is very strong on culture. We've never touched that before. Why an investment case in culture? Let me tell you something. When the sea level rise is coming away, it takes away the old village houses and mounds. It takes away the funeral places. It's to us like losing the pyramids. It's to us, it's like losing your old building. Because that's who we are. That's what we are made of. And there has to be an investment case for protecting our culture, also as part of the investment case for the other areas around health and so forth in climate change. Our culture is eroding away with every sea level rise. Thank you.
Thank you. That's really sobering. And on that note, I'd like to thank you and hand over to Dr. Ilona Kickbush for the next panel, because it will deal with some of these questions also at greater length. But for all of us to take away what has been said, I can't put it in better words than you, and I don't want to summarize it, but that investing in saving humankind, animal kind, plant kind, is saving our culture, our core, what we are. And that, once lost, cannot be replaced. Thank you very much for this discussion.
Thank you very much, and welcome to the second panel. And as of today, I go nowhere without my polio bear. And I'd like us all to give a special clap to the successes of the polio replenishment. So it is my very great pleasure to invite the participants of the next panel to please join me here on stage. It's Mr. Marco Lambertini, who is the Director General of the WWF International. Please come and join us. I'd like to welcome Ms. Maria Fernanda Espinosa, an old friend, the President of the United Nations General Assembly for the 73rd session. Wonderful to have you, Maria. I'd like to welcome Dr. Jeremy Farrar, the Director of the Wellcome Trust. We join forces on the Global Preparedness Monitoring Board. And finally, I'd like to welcome Ms. Masiko Matembu, who is here as the youth representative. Please join us. We will jump into the discussion straight away. And Mr. Lambertini, you heard the Minister of Health of Fiji and the challenges he's facing. Your organization, it says, deals with the most pressing issues of this intersection of climate, nature, people. Could you say what is the most pressing issue for your organization? Where do you think we should be moving forward? Because that's the title of this session, Moving Forward.
Thank you very, very much. Can you hear me? Yeah. Thank you very, very much. And first of all, let me just say something quite clear. I am the General of...
Try this.
Hello, can you hear me now? Yes. A little curiosity, because I am the Director General of WWF, the World Wide Fund for Nature, but I'm also a pharmacologist. And so for me, it's actually a natural match. Nature and health has so many different points of intersections. But because you gave me only 2 minutes, I'm going to focus on a hot topic of today, which is also a priority for our organization right now, which is about nature-based pandemic prevention. All this is happening at a time when actually I would like to commend the WHO that from the very beginning of the outbreak of the COVID-19 pandemic highlighted the importance of a One Health approach, highlighted the links between nature, human health, animal health. Also in the face of so much evidence, more than 70, almost 80% of the emerging human infectious diseases are of zoonotic nature, meaning are spilling over from animals to humans. One of the 1.7 million viruses that are estimated to be potentially harmful for humans, half of them are hosted in wildlife. But normally, viruses are kept on check in stable, healthy ecosystems. It's when we disrupt those ecosystems, deforestation, forest degradation, wildlife consumption, encroachment of human settlements or animal farming in wild places, wildlife trade. Wildlife trade, illegal wildlife trade, is the fourth trade in terms of amount of money after arms, drugs, and people. So when we disrupt ecosystems in that way, we expose humans to viruses, we unleash much higher viral load into stressed wildlife, and this is where epidemic and pandemic can emerge. Let me just say one other final thing, because this agenda can be seen actually as a very positive agenda. Preventing pandemics through nature-based investments is about sustainable forestry, forest conservation, is about providing more sustainable and viable alternatives to food and livelihood to local communities, particularly the most vulnerable in these remote areas. It is about creating more health centers and surveillance centers in these remote areas again. And so it is a positive agenda that helps both nature and human development at the same time. And your sector, the health sector, and this is the end, the health sector is used to, probably more than any other sector, to really understand and embrace prevention. And this is what we're talking about here, is pandemic prevention at source is the earliest possible measure of pandemic prevention.
Thank you very much, Marco, and thank you also for sort of taking up the investment team. You said, you know, pandemic prevention through nature-based investment. So I think, you know, that's a really, really interesting challenge for us to take forward in the context of the One Health agenda. Maria, you are more knowledgeable about the UN system probably than anyone else in the world. You've been so involved in the Sustainable Development Goals. We're slipping back. We have slipped back. The question is, what must be done to catch up? You know, where do we move forward?
Well, Ilona, I have bad news and good news. The bad news is that we have missed almost every single Sustainable Development Goal and every indicator, unfortunately. And the reasons, I think we spent 3 days assessing why. The COVID-19 pandemic, the cost of living crisis, inflation, recession, the war in Ukraine. We have many explanations on the why. And I think this poses a serious trust deficit in the multilateral architecture, but also in the capacity of our democracies to perform and deliver for people on the ground. So these are the bad news. So we're not doing well. But the good news is that here, I see a very strong and vibrant community of knowledge together with a community of practice, what we call an epistemic community. And when we say universal health coverage, and when we say health for all, and primary health care, and health security, and health infrastructure, and health investment, I think we understand what we mean by that. And we also understand how to go about it. The idea of, and you said it so clearly, a whole of government approach, a transsectoral approach, a whole of society approach, co-responsibility, the role of civil society, of science, of academia, of the private sector. So we understood that it's not about a Band-Aid approach. We understood that is a holistic approach, and the Sustainable Development Goals, unfortunately, are crafted in a silo way, but we cannot respond from the societal and political perspective in a silo way. It's not a time for a Band-Aid approach. It's for a One Health response. And I really want to commend the One Health initiative, because that's the way to go. And that brings together FAO, UNEP, WHO, coming together to deliver a One Health approach. And I'm totally with you. I'm super happy that WWF is here, because it is about reconciling with nature, making sure, you know, the COVID-19 is most likely a zoonotic disease. And it is the way of nature to speak to us, to humans, and to tell us, you are going beyond our boundaries. Please stop. And we need to stop. And basically, again, the good news is that we understood, because of COVID-19, that we need a profound retooling of the multilateral architecture, not only the multilateral health architecture. And that's why I am personally so involved in the UN reform agenda. And it is about more smart funding of the whole system, not only of WHO, but to have greater accountability, greater inclusiveness, and greater democracy in the multilateral scene.
Thank you very much, Maria. And I'll move, please. I think that has been reinforced in many ways, you know, during our discussions. And I move straight to Jeremy. Because Jeremy, this feeling, you know, something needs to change. The reform is in the air, everyone says. We had a debate, are we talking about an architecture or an ecosystem? And, the whole dynamics of change that is there now. But at the same time, if one says, let's get things done, a certain group of people comes together, gets things done, but then the decisions weren't really inclusive. And that was part of our problem during COVID-19. How do you see that looking back, and what must we do as we move forward?
Yeah, well, sorry, woke me up. Thanks very much, Ilona. Having been the head of an organisation that's just gone through a major reform, all I'd say is good luck to you and thick skins and keep going, because it's difficult and it's painful. But I think your challenge is appropriate, Ilona. But at the start of the pandemic, I would argue those structures that brought together the different strands, which were all set up for very good reasons and have delivered amazing progress in the turn of the century, but actually, it's not a criticism, but we're working in relative vertical structures. And there wasn't actually a mechanism which brought all of those actors and governments and civic society together under an umbrella that had a mandate to do that. And that's what generated the coming of the ACT Accelerator, and it certainly can be criticised and challenged for not delivering as fast and as well as it possibly could have done. But I would argue that without bringing that together, and critically under the convening power and leadership and then secretariat as well of the World Health Organization, which ultimately is the mandated organization that the world's governments give the responsibility to, but without necessarily always giving the authority or the means to deliver it. But I believe that the ACT Accelerator coming together was the horizontal structure, whether for vaccines or diagnostics or therapeutics or social sciences or the horizontal health systems, that ultimately we need to have going forward underneath the umbrella of the World Health Organization and then through into the United Nations system.
Thank you, Jeremy. Maziko, to come to you, there is a discussion out there, particularly by young people, young scientists, young activists, who say global health is outdated anyhow. We actually need to reinvent it. And there are various ways of thinking about it, from planetary health perspective, from equity perspectives, etc. How do you think, as we move forward, how do we have to rethink global health?
Okay. I was just checking if you can hear me. First of all, I just wanted to start off by reintroducing myself. I'm Maziko Matemvu, and I am the founder and president of UWALE, and also the vice chairperson of the PMNCH Adolescent and Youth Constituency, and I'm based in Malawi. I read somewhere that if you're a fire, don't let people call you a spark. So I just wanted to start off by saying that. And also, now to get back to your question, when we're talking about global health, first of all, we need to understand that young people are very crucial to changing the landscape of global health. We are 1.8 billion young people in the world, and the power of young people is probably the most untapped yet crucial resource that we have to our disposal today. And tapping into this powerhouse, like I've said, of human potential can transform global health landscape and help us achieve our sustainable development goals. But we cannot do this if we're not meaningfully engaging young people, and we cannot do this if the young people themselves cannot afford basic healthcare services. I wanted to proceed by saying that financial protection is generally low in Africa, which requires most patients to pay for services from their own household income, out-of-pocket payments, and the fundamental notion of universal health coverage is leaving no one behind, yet young people themselves are at the threat of being left behind. Universal health coverage promotes people from the financial consequences of paying for health services out of their own pockets, and also reducing the risk that people will be pushed further into poverty. It's easy to be in rooms like this and talk about how we should move forward. But like I mentioned, I come from Malawi and I work with communities and young people in hard to reach areas. And it is very important that as we are planning on moving forward, we have the young people, the most marginalized, at the heart of our interventions. So I just wanted to start off by saying that it is important by, number one, ensuring that, first of all, we do strengthen health financing and holding governments accountable to delivering the commitments on prioritizing adolescent well-being and health through the already existing commitments, whether it be the Abuja Declaration, the ISA ministerial commitments, but also number two, making interventions and approaches inclusive, especially for the most marginalized and young people with disabilities. Number three, to build progressive and health systems, we cannot leave anyone behind. It's easy to talk about, okay, as we move forward, let's do all these cool digital interventions that are going to make things faster and easier. But we come from communities where majority of the population live below the poverty line. We come from communities where majority of the population do not have access to the internet. So we need to ensure that as we are moving forward, how do we leverage on indigenous knowledge? How do we leverage on traditional methodologies to really make global health and quality healthcare a reality? I know I'm running out of time, but to also just say that meaningful youth engagement is also very crucial as we're looking at global health. And earlier today, I mentioned this in the other session, is I was asked by a young lady who said, how do I get a seat at the table like you? It was so funny. And I was like, what do you mean? And she's just like, oh no, you're speaking on this panel. And like, I want to know, how do I get a seat at the table? Having a seat on a panel like this is not having a seat at the table. Young people have to be meaningfully engaged, and that means being respected as equally sharing partners and stakeholders from the beginning to the end of the project and program cycles. And we have to be in control of the narratives that affect us. So first of all, meaningfully engaging young people will also ensure that we're not imposing what's going to work well in communities. We need to understand from the communities themselves and young people themselves what is going to work best for them.
Thank you very much. My guess is there's a lot of young people in the room who are of the very, very same opinion. That's how it should be, and we've listened very carefully to what you've said, that, you know, these kind of representations should not be symbolic. They need to be really deep, they need to be regular, they need to be responsible, and they need to be respectful. And I thank you very much for that. We need to move on. I do need to press you. Maria, if you could just in a very few words say something about next year. We are talking about moving forward. A lot of the moving forward is actually doing essentials, as we just heard. And of course, next year, one of the summits at the UN is going to be universal health coverage, the very essentials that you spoke about, Maziko. And on the other hand, the issue that was raised by Marco, a pandemic summit. Now you said, let's get away from all these verticals. And now we're talking two summits, one on UHC and one on pandemic prevention. What are we going to do?
Wow. Well, basically, I would say two things without wanting to be prescriptive, but I think we all have the responsibility to work on weaving coherence between summits and high-level meetings. We have the responsibility to fight this summit fatigue, this summit indifference, because we need to keep the tension, the attention, the gravitas, the political momentum, starting with next year Universal Health Coverage Summit, the TB high level and the pandemic high level and the SDG summit. Let's don't forget 4 summits the same year to prepare for the 2024 Summit of the Future and the 2025 Social Summit.
A machine.
It's a machine of summits and high-level meetings. So basically, our collective responsibility is to make sure that there is a consistent message, a clear narrative, a to-do list for leaders, but for ourselves, for society as a whole. And I agree, health is a political choice, but it's also a moral responsibility, a self-preservation responsibility. And I think that we have to work with that. And after these 3 days, I think that we have pretty much clarity on the why, some hints on the how, but I think the big question, Ilona, is the who. And the who is a collective who, is we the people's who, is a shared responsibility to put health at the center, gender equal health systems, equitable health for all mechanisms. And yet again, these are, governance designs, and governance designs and institutional designs are human-made. So it is on us, it is on all of us, including our political leaders. And I really commend your voice that has to be permanent, consistent, and everything about you with you, the younger generations, of course. Thank you.
Thank you. Jeremy, I'd like to come back to you. And, as I just reacted, here is this machine. And we heard about so many summits, and I can think of so many people who say, yet another summit, and yet another summit. And how much do all these summits cost? And, where do we finally end up in that? And you've been very close also as a member of the GPMB to all the work around pandemics. Do you have a feeling it needs a crisis to get us going? Or is it like even the Minister of Fiji and you indicated, it seems sometimes not even a crisis gets us going. So how do we move forward? Who should actually be acting? Those people who glued themselves to our conference center? What makes change?
Yeah, the people who glued themselves to the conference center are just vocalizing or bringing to attention the challenges that are existing in the society. We just heard again of the challenges driven by inequity. I mean, crises don't create inequity, they amplify inequity, but the inequity was there before. And it's there in all of our society, it's in all of us as individuals, it's in our organizations, and we should look at it. On the warnings issue, do we need a crisis? Unfortunately, sometimes we do. But I think there is in the 21st century, I think we have a really challenging political environment as well. The ability of many political systems of any type to cope with the very major challenges of today and tomorrow, which are real and have to be addressed in a 24-hour news cycle, but also think, how do we prepare for these existential crises that are coming in 5, 10, 20 years' time, whether in Fiji or in Europe or in Africa? And I think our political systems at the moment are really struggling with combining the day-to-day challenges they face and also the long-term challenges. I think, where do we push into that? We all have a voice into that political system, some less so than others, and that has to be addressed. But if we don't push for change prior to a crisis, then we won't have had the change when the crisis hits that we can then cope with. And if you look at the challenges of the 21st century, I think they are all about transglobal, they're transnational, climate change, health, political choices, energy, water, etc. If we don't address these both in the short term but also the long term, I think we're going to be constantly falling over ourselves in the 21st century.
Thank you, Jeremy. I'll come back to you, Maziko, then. Here is this big climate crisis. There is the lack of access to universal health coverage, as you said. There's a concern of young people that they're not being heard. And if we look at many of the African countries, many of the Asian countries, the majority of the population are young people. and we're not really building systems for their future and their participation. If you were to give one piece of advice to the audience here, not the young people here, they know it already, the other audience, what would it be?
One?
Yes.
There's a lot.
The difficult of choices.
I think there is so much that has to be said, and also to just mention that, climate change is obviously one of the greatest threats to human rights of our generation, and also poses a serious risk to the fundamental rights to life, to health, to food, and adequate standard of living for individuals. If there was one thing that I would say is that we cannot build crisis-resilient health systems without engaging communities. And we cannot talk about engaging communities and people that are affected the most without talking about the uncomfortable subjects, like decolonizing our approach to healthcare systems, to addressing these issues. How would you feel if I came to your house and I told you how to do things in your house? I mean, you look at me like, girl, first of all, who are you and where are you coming from? We live in two different contexts, but I'm telling you, you have to do this and that. I mean, it just shows that you don't respect me. And that's how we feel in our communities, because we have all these huge organizations coming, claiming that they want to help us, but they're telling us what to do. You're not engaging us. You're not asking us what's going to work best for us. You're telling us how to think. And it is a colonial mentality, and it has to stop. It has to end. It's unacceptable. It's unacceptable. And earlier on, somebody had asked me like, oh, are you excited to speak? No, I'm not. Because when I was younger, I used to watch sessions like this, and it's the same thing. Are we really still talking about this in 2022? It's tiring, honestly, and exhausting, if I'm being completely honest. But back to the point is that we need to meaningfully engage communities, and they have to be at the forefront and shaping their narratives, and we shouldn't be told what to do. We have to tell you what works best for us. And that's how this is going to work, because that's how communities and young people are going to take ownership on these issues that are affecting them, these policies that are affecting them, these projects that are affecting them. And we need to decolonize our approach.
This panel is slightly overrunning its time, but I can see how important this message is to you, and therefore there is no reason, to actually cut down the voice. I just want to end with we've heard that message from the young people, the message to the audience, the message to all of us, the organizers, the older people who've been around saying the same thing for the last 20 years. But one message, Marco, to this audience.
There is no way we can build a safe future for us unless we really look at nature as an ally. And not only as an ally, as the foundation for food, nutrition, water, happiness, well-being, health. And we got to really stop taking nature for granted, because unless we invest our energy to coexist with nature, we'll find ourselves at the end of the road in trouble. We depend on nature more than nature depends on us. When we say, even in WWF, when we say we want to save the planet, well, friends, the planet will go ahead. It will adapt. It will find ways. It's us. It's us, our children, my children, your children, their children, they're going to pay the price. And that's just not right. That's why nature conservation now, today, I really hope, is beginning to be perceived not just as an ecological issue. It is actually an issue of security for humanity, and frankly, is an issue of justice. Justice for the people that are suffering most out of climate change and nature loss, and justice for the young people that tomorrow will have to deal with a really, really difficult legacy. So nature is our best ally.
Thank you. So with great sadness, I have to end this panel because we've spent longer than we should already. But I hope these messages that have come across resonated with you. You clapped at certain points, and I'd like you to give a final thank you to the group here. Thank you very much.
So the challenge has been laid for us to structure this agenda going forward for all of the meetings that are coming for next year, for all of the leadership initiatives that will be undertaken next year, to be done in such a way that don't make young people feel disconnected. Hi, is my mic? Oh, you kept your mic. You want to keep it? Okay. Don't feel disconnected. And you know, you make a very good point about the disconnect between what we are doing in this room and the realities that are being felt by youth on the two youngest continents, especially in Africa and in Asia, where the median age is less than half than the median age on this continent, and maybe we're losing sight of that. So thank you for that reminder. We have a video presentation now that lays out what the government of Japan is proposing to do in its G7 presidency next year. So I'd like us to listen to that, if only to be able to give strategic input into how that may be shaped in a way that engages everybody on the planet. So video, please.
ワールドヘルスサミットにお集まりの皆様、こんにちは。厚生労働大臣の加藤勝信です。ワールドヘルスサミットは、グローバルヘルスに関わる世界中の皆様が一堂に会する権威ある国際フォーラムです。さらに本年は、ドイツが G7 議長国を務められていることから、G7 での議論とも連動したさまざまなプログラムをこのサミットでご提供されていると伺っております。このような記念すべき年に私も参加させていただき大変光栄に思います。貴重な機会をくださったサミット議長のアクセル・プリーズ先生をはじめ関係者の皆様に厚く感謝申し上げます。日本は来年 G7 議長国を務めます。長崎で保健大臣会合を、広島で首脳会合を開催する予定です。前回日本が議長国を務めた2016年はエボラ出血熱が猛威を振るっていた時期でありました。そして世界は再度パンデミックの脅威にさらされました。新型コロナウイルス感染症の戦いが始まって3年を迎え、私たちは世界で協力しながらこの未曾有の健康危機に対応してきました。同時に健康危機に直面する中で各国、地域、そして世界全体の保健システムにさまざまな脆弱な部分があることが明らかとなりました。以下4点について申し上げたいと思います。第1に、新たな病原体に迅速に対処するためには、第一線で対応にあたる医師、看護師をはじめとした保健医療人材の確保はもちろんのこと、健康危機に対応できる公衆衛生の専門家を平時から十分に育成しておく必要があります。第2に、世界のどの地域からも必要な情報が迅速に共有されるよう、 国際的な取り決めが適切に整理され、各国、各地域のサーベイランスシステムが十分に連携されることも喫緊の課題です。第3に、ワクチン、治療薬、診断薬といった必要な医療資源を早期に開発し、世界全体に公平に届けることの重要性も強く認識され、DX を活用したヘルスイノベーションも期待されるところであります。第4に、目下のパンデミックへの対応だけでなく、将来の健康危機へ備えるためには、資源や保健システムが不十分な地域や分野を適切に見極め、十分な資金を確保し、平時からの投資を行っていくことも欠かせません。このように、未だ続く新型コロナウイルス感染症への対応、経験から得られた様々な教訓を踏まえて、次なる健康危機への予防、備え、対応を強化するためのグローバルヘルスアーキテクチャを構築していく必要があります。そして将来の健康危機に対応するにあたり、忘れてはならないのがユニバーサルヘルスカバレッジであります。日本は世界に先駆けて国民皆保険を達成した国として UHC の議論をリードしてまいりました。人口構造や疾病構造が変わりゆく社会においても、平時から人々の命や生活を支えることができる。また、パンデミックのような有事にも対応できる UHC の重要性が改めて認識されています。私たちは来年の G7 保健大臣会合において、より強靭、より公平、より持続可能な UHC を達成するために、G7 各国がどのように世界に貢献していけるのか、これからのグローバルヘルスに資する議論を行いたいと考えています。今後、本年の G7 議長国であるドイツをはじめとした G7 各国の皆様と連携しながら、来年の議論に向けた準備を行ってまいります。新型コロナウイルス感染症やサル痘など次々と新たな健康危機に直面する中で、私たちは着実に将来の健康危機を予防し、備え、対応する力を強化していかねばなりません。日本は世界の皆様と一緒にグローバルヘルスの議論を通じて、これまでの教訓からより良い未来を築いてまいります。今の、そしてこれからの危機に共に立ち向かっていきましょう。本日は貴重な講演の機会をいただき、誠にありがとうございました。
Thank you very much, Minister Kato. Germany is, and I'm going to mix metaphors mercilessly here, passing the baton to Japan for the G7 presidency, and yet holding on to the thread so that there's continuity in the global health effort, coherence in the strategies that we wish to adopt for the future. End of mixed metaphors. State Minister Stefan, if I could please invite you to tell us how Germany proposes to continue to act, perhaps more in the background, but continue to prioritize global health going forward.
Dear Mr. President, distinguished guests, ladies and gentlemen, it's a real privilege. It's an honor for me to speak at this closing ceremony of the World Health Summit 2022. And it was a real interesting, it was an exciting panel, especially the last one. And I also as well enjoyed the words by Dr. Tedros and on behalf of the World Health Organization. And when he referred to John Lennon, two things came to my mind. The first one is that I thought whether all these young people in the room still know and remember John Lennon, but I guess this is the case, at least I hope so. And the second thing that came to my mind was that John Lennon once was asked what the favorite song was that he ever wrote. And he said, You know, it's not just one song, there's a couple of songs. It starts with Strawberry Fields, it starts with In My Life, and with Help. And also help came to my mind listening to all the colleagues on the panel. Help, I need somebody is maybe something that we should apply to today's situation of global health. It needs somebody, and maybe it needs us to overcome today's situation. And that is why I believe that we should do two things, at least two things. The first one is that we all together should continue to strengthen the WHO. It is, as we just heard, the only organization which is mandated for global health. And of course, it's the only multilateral approach that we have on a global basis. And you know that Germany and the German Federal Ministry of Health is a long-standing partner of the World Health Organization. And we are very, very happy that this year it was able that the World Health Summit was organized together with the World Health Organization, which is a very solid basis and which is part of our common success. And the second point I would like to tell you we should do is to continue that very open dialogue that we have seen here in Berlin, that we have seen other places of the world. And why should we apply this very open dialogue? Not because we can all together push a button and then there is the solution, but because of a very, very simple principle that I would like to recall. And this very, very simple principle means the wisdom of crowds. The wisdom of crowds, meaning that the many are always smarter than the few. This is a principle that shapes economies, it shapes societies, and it shapes nations. And I guess we have to bring together the wisdom of all of us to overcome today's situation and to make the world a better and a healthier one. And in that sense, the World Health Summit gathered the visionaries in global health, politicians, scientists, representatives from the private sector and from civil society. Together, we strive to find solutions to global health challenges. And as you mentioned, Germany holds the G7 presidency in the year 2022. We are in very close cooperation with our G20 colleagues. And of course, we are happy to hand over to the Japanese colleagues, also in very good collaboration. And of course, I have to add that we are all in a very, very special circumstance. Germany, as well as the other G7 countries, we are living in unprecedented times, I would call them. Today, the world is confronted with complex and interconnected crises. The ongoing COVID-19 pandemic, which is, as we all know, not yet over. The climate change, which was mentioned many times. The illegal Russian invasion of Ukraine with the resulting humanitarian, food and energy crisis. This calls, in my view, for very strong political leadership and synergetic international collaboration. Germany is committed to shaping a global health architecture which is less fragmented, better coordinated, more efficient, and has a truly inclusive global health governance. I am pleased to state that this year's World Health Summit, also in this respect, was and has been a great success. And that is why I would like to send my best congratulations to the joint team of the World Health Summit and the World Health Organization for enabling candid and in-depth discussions on pressing global health issues. Speaking for myself, but not only speaking for myself, also speaking on behalf of Minister Karl Lauterbach and the team in our Ministry of Health in Germany, we gained numerous valuable insights for the policy-making progress and process we are in, which will feed into the international processes which lie ahead of us. For example, the G20 meeting in Bali next week, where the health ministers will meet and will discuss those things again, hopefully leading to good solutions. I would like to end by recalling and reminding all of us, together we make a difference. Thank you.
You can stay here. Thank you. Thank you very much, Phil. That is a great line on which to end this meeting. Together, we make a difference. And as part of the conclusion, I would really be very pleased to invite to join me on the podium Professor Dr. Axel Priest, President of the World Health Summit, without whom this meeting could not have happened, could not have been a success. And Dr. Pascal Alloté, member of the Executive Committee of the M8 Alliance. If you could please come up onto the stage. From me, auf Wiedersehen in Berlin.
Okay, we were between you and your glass of wine at the end of the day. Very quickly, I just want to note that I chaired a session this morning on health systems resilience and health equity. And one of the critical lessons that came out of that was the importance of learning systems. And I have to say that the M8 Alliance and the organizers of the World Health Summit, this is absolutely a learning organization. I've been involved with it since 2010, when I was with Monash University and then with the United Nations University in Malaysia, and now where I sit with the World Health Organization. And through 2010, when my first meeting was very much one that focused on medical students. It was the M8 Alliance was set up to really focus on ensuring that health professionals that are trained also were able to engage with the politics of global health. That was the initial idea. And in a very short time, this M8 Alliance and the World Health Summit has evolved into this amazing, amazing space that allows for academics and policymakers and politicians to all come together. Just to show you how much it's learned as an organization, I think Ilona was one of the first women who started talking about the fact that we can no longer have man-only panels. And she started a Twitter campaign for people to nominate women, because the easy answer then was, yes, we know we've got this panel, but we don't know any women who are qualified to be able to do that. And we're now at a stage where it's 50% representation. So that is a really important gain. The other point is that it is now an organization, as I say, from one that was with largely students and discussions around medical curriculum, to an organization that we had the signing of an MOU between parliamentarians in the WHO. This is an amazing space. So I would like to appeal to the young voices to say, we are learning, we are listening to you, and I'm very sure that you will see further evolution that makes this an increasingly inclusive space. And I hope we will see you all again next year. Thank you very much.
Yeah, thank you, Pascal, for these remarks. And I have to give you the numbers. We have 203 female speakers and 201 male speakers, so we made it, the 50%. So. And we have them from all areas in the world. I was allowed to mention that Dr. Wakaina Bete, the health minister of Fiji, had to travel 36 hours to come here. So give him a big applause. And he's not the only one. Together we can make a difference, like our state minister said, and that's absolutely needed. And we heard about very sobering facts. Don't neglect that, also from Fiji. We heard about crisis, but we also heard about very optimistic and uplifting new initiatives. And we all are concerned, and we can be concerned, but we have to be optimistic and active, because if you are pessimistic, you don't do anything, you sit and wait. We have to be optimistic and change things. And despite all summit fatigue, I would urge the decision makers of this world on all levels, in all different capacities, to read the writing at the wall and to make the right decisions. It's always forgivable for all of us to make not the optimal and right decisions first place, but it's not forgivable in these circumstances not to make decisions. So that's the take-home message from this meeting. So I wanted to tell you that here in this group, we have 4,100 participants from 141 countries, and we have about 60,000 online, and that's really a big success. And that has been only possible by all of you coming here, obviously, by our partners, and I would also like to thank the German ministries for supporting us, the WHO. You are M8, but now I address you as WHO too, which is a good thing to do. The first time with this logo was really a success, and it was a very pleasant journey. And I think we reached the goal of this journey. And I would like to thank, obviously, my team. I can only name Julian Kickbusch and Jörg Heldmann. All the others in the team of the WHS also require a big applause, please. But I would also like to thank the people from the WHO. Gaudens is sitting here, and Katharina Böhme was there, and my very dear friend Tedros, who had to leave for his plane. But we could only do it in this very interesting combination of a small and agile team and a worldwide organization, which, as our state minister said, is the organization for global health in the world. And with that, I would no longer impede you from going to the buffet. This meeting is over. We will see us again next year, and we have to look for the advances on the ground. So stay healthy.